general health insurance that we get here.
Mm-hmm.
It covers everything. Like if you need medical attention,
Okay.
everything will be covered by that. And if you take the public health insurance, you don't
Mhm.
have to pay anything out of your pocket.
Okay.
They will get a card.
Mm-hmm.
You can just show the card, and then like, whatever medical needs that you have, it will be
Mhm.
covered by your insurance company. So the doctors will directly contact your insurance company, and then they will get the money from them.
Okay.
It even works on the pharmacies when you're getting some tablets or something.
Mm-hmm.
You might not get it completely free, some tablets,
Okay.
but you would get it in a significantly subsidized way.
Okay.
Like if a tablet costs 10 euros, you just
Mhm.
have to pay 1 euro or 50 cents.
Okay.
So it's like very subsidized
Mm-hmm.
because you're paying almost 100 euros per month for your health insurance. So
Okay.
it will cover everything.
But
So,
there is no limit. Even if you go for the bigger surgery or
yeah,
something, there is no
everything
limit,
is
right?
covered. There is
There
no
is.
limit.
Okay.
So the first thing how it is structured is
Mm-hmm.
you, let's say if you're feeling a little bit ill,
Okay.
you're feverish or something, you cannot go directly to a big hospital.
Mm-hmm.
You should go to your house first,
Okay.
which is like your local family doctor.
Mm-hmm.
It can be anybody. Like it's usually a doctor nearest to your house.
Okay.
You can just have a look online, like see the doctors near you, and then go to somebody who, like, if you don't speak German, you can just go to somebody who speaks only English. Like
So you can find out in the
yeah,
Google.
in the Google itself you can find. You
Mhm.
just have to look. So, or you can ask your friends, or you can ask your somebody who's there.
Mhm.
Like even you can even ask your professors, or in the student exchange office,
Mhm.
they would help you with everything that
Okay.
is not related to your studies. Anything related to your studies, you can ask your professor.
Okay.
But anything unrelated to your studies, you can just ask the student affairs.
Okay.
So the health path is like this. So you
Mhm.
first go to your house.
Mhm.
He would check you, and if he can resolve it by himself, he will
Okay.
just give you some tablets and then
Mhm.
give you an injection or something, and then be done with it. But if he feels you something serious, then he would recommend you to a big hospital.
Okay.
And
So
you
the specialized one.
Yeah, you need the recommendation from him
Okay.
for the hospital. You also need it for the insurance
Okay. Okay.
because you need it. You go to the hospital that he recommended. You
Mhm.
show that they need it because you need the insurance company needs a good reason for this type of higher medication for you,
Okay.
so
Okay.
that
Okay.
it justifies the cost.
Otherwise,
Yeah,
okay.
it's not like you just get a headache, you go to a big hospital and spend like 500 euros and expect the insurance company to pay it.
Okay.
Doesn't work like that. So
Uh-huh.
since the insurance company is paying for everything, you have to go from the small doctor, and then when he feels necessary, he would recommend to you a big doctor, and then you go there.
Okay.
So, and it works like that. And the German people here, they just go to the doctor even if they are feeling like, from India, we usually don't, like, we avoid going to the doctor.
Uh-huh.
So like even if we have like a huge fever, we'll just let it for 2 days, and then only if it doesn't get better, we'll go. That's how I did.
Okay.
So, but the people here, since it's public health insurance, and
Mhm.
since there is a proper infrastructure, people just go. If they are not feeling well, even if they feel like they are not feeling well, they just go to the local doctor.
Okay. So you
So-
can get it recovered early.
Yeah, so it's always you have to get that mindset.
Mhm.
You're alone here. You're come here to study. Your health is your number one priority.
So don't wait actually.
Yeah,
until
and
it
you're
get extreme.
paying like hundreds of euros every month for your health insurance. So it's always good to just, even if you're feeling a little bit, if you feel something is wrong, you just go to, because I made a mistake.
Mhm.
I had like stomach pain for like 3-4 months. I just assumed it was like normal.
Okay.
I was not eating because I was doing my thesis.
Mhm.
So I thought it was stress, and then so since I was not eating well, I had a little bit of stress, so I just like left it. And then one day it was like, so I had a fever for like a week. I had my lymph nodes were a little bit enlarged.
Okay.
And then I was like too worried, and then I went to the doctor, and by that time the doctor could not feel like he cannot say anything. The local doctor could not say anything.
Okay.
He did not know what it was. He was also not sure, and then he recommended me to a big hospital here in Stuttgart.
Uh-huh.
So I went there. They thought it was something else, and then I said I had like stomach pain and stuff. They thought it was appendicitis, and then it was like it was already too late. That's what I'm
Okay.
trying to get.
Okay. And
So-
it took you actually really long
yeah,
time to
because
recover
and
from
then
that.
they found out I had like tuberculosis, like a rare form of tuberculosis in my intestine.
Mhm.
And then I had to stay in the hospital for like 6 months, and then I had to spend another 3 months in recovery. I
Okay.
had like multiple surgeries and stuff.
So in that case, if the visa expired actually during that time, they will send out, right?
Yeah, my visa was expiring at that time,
Mhm.
but the people in the hospital, they would help you actually.
They will help you.
Because they contacted the visa office. I got my visa extension while I was in the hospital itself. I didn't
Okay.
do anything. The hospital contacted the visa office. They took care of everything,
Okay.
and then I got a temporary visa when I was there.
Okay.
And I was doing my thesis at the time also, and my company.
Mhm.
I was not. I was working in a German research institute.
Mhm.
So they also like they sent me multiple extensions. Like when I was there,
Okay.
they posted my new contract for next six months because
Okay.
I was 3 months into my thesis. I was supposed to finish it in 3 months. I could not do it, so they sent me extension for 6 months when I was there, and that 6 months went over, and they still could not do join them,
Okay.
and then they sent another extension. So yeah, people here are very helpful.
Okay. Okay.
Like if you are like my case was like the worst thing that you could imagine, but still like the doctors were very good, they were very professional, the nurses were very good, the people there, they were also very good. I was basically staying there for like 6 months.
Okay.
Everybody
that
knew,
is- that
everybody
is-
at the hospital knew me.
Okay. Okay. But yeah, 6 months it's long time
Yeah.
actually to stay in the hospital.
Yeah, but yeah, the health system is good. The hospital that I was there, that was also very good.
Mhm.
So, and I heard that like that's the best hospital in Stuttgart.
Okay.
Like from the patients there.
Okay. Okay.
So like if you have any problems, you just get it done itself because you are paying like
Yeah,
every
as
month.
soon as possible. That is important. That's what you are trying to say.
Yeah, as soon as possible. Even if you feel a little bit down, you just visit your local doctor, get advice from him, and that insurance will cover also your like some psychiatrists if you have some mental issues. Like if you're feeling very stressed and if you feel depressed, you can
Okay.
also that insurance covers that also.
Even something related to eyes and teeth also, right? Teeth
Yes,
alignment, eyes.
teeth and eyes also it covers. Like
Okay.
if you really need it, unless it's cosmetic. Like if it's cosmetic, then it doesn't cover. But
Doesn't cover.
if you really need it, then it covers.
Okay. Okay.
Like if you have a cavity or something, you need your tooth pulled out, then it covers.
Mhm.
Thank you guys for watching the video. Please like, share and subscribe to my channel.